very good morning to you, dear listener state. This morning of cancer and also raise awareness on ways of managing as well as ensuring its prevention. Yesterday was observed as World Cancer Day. It's a day set aside to raise awareness about the prevalence of cancer and how it can be properly managed. According to the World Health Organization, it revealed that cancer prevalence is so dangerous that 40 people worldwide are diagnosed with cancer almost every minute. And this raises concern to its prevalence across the world. And back here in Nigeria, the Association of Radiation and Clinical Oncologists of Nigeria, ACON, also raised concerns about the need to invest in oncology infrastructure to increase awareness as well as improve life-saving access to treatments for cancer, and of course cancer experts on its management. This is why the subject matter is very critical. And if you look at the prevalence of the several types of cancers ranging from cervical, prostate, breast cancer, they are said to be some of the leading causes. Breast cancer in women in general is said to be one of the leading causes of death in women, and the prostate is for men. We shall dive into this subject matter to understand ways of managing this cancer, ensuring its prevention. I've been joined here in the studio by three medical experts who will offer insights on this subject matter. So we shall drive the conversation together. First is a consultant obstetrics and gynecologist at the Federal Medical Center, Makurdi. Dr. Ugboaja Chisa is our guest on Perspectives. Welcome to the program, Dr. Chisa.
Thank you. It's my pleasure being here today.
We also have with us on the program a consultant ophthalmologist at the Benue State University Teaching Hospital, Dr. Tongriang Ben-Ameh. Welcome to the program, Dr.
It's a pleasure being here. Thank you for having me.
And of course, joining us on this edition also is a consultant family physician at the Federal Medical Center, Makurdi. She is the president, Medical Women Association, M1 Benue State Branch, Dr. Patience Okpeh. Good to have you join us on Perspectives, Dr. Okpeh.
Thank you so much. It's a pleasure being here.
And I am Nathaniel, Nongu, welcoming you to this Wednesday edition of the program. You may be tuning in to Perspectives for the first time. Don't worry, the simple information we have for you is Perspectives is audience participatory. At 10 o'clock, we allow you, the listener, to phone in and contribute on the subject matter we are discussing. You can reach us on the number 0814-335-9292. 0814-335-9292. Meanwhile, the SMS line, which is also available on WhatsApp, through which you can also contribute on the program, is 0912-699-9404. 0912-699-9404. You may log on to our website on www.iGetRadioTV.com to listen to us and access other content of iGet Radio as well. This program is also streaming live on all our social media platforms. We are available on Radio Garden, and you may also download the iGet Radio and TV app from Google Play Store. One-stop app which avails you the platforms of our television online, the radio, as well as newspaper. We're available on all these platforms to serve you beyond boundaries. Kindly join us to be a part of this conversation. We'll take a short breather, and once we are back, our discussion starts here in the studio. Kindly stay with us. Welcome back from that short break. Let me begin with you, Dr. Ugboaja. Kindly give us insights into what is cancer. Oftentimes we hear the word cancer, but medically, what does it mean?
Okay, thank you. Cancer is, like you said, it's something, it's usually one of the most how will I put it? It's one of the worst things you can tell a patient that he has. It's a difficult diagnosis to, discuss with the patient. Essentially, it refers to an abnormal growth in any part of the body that has the ability to spread to other parts of the body. Okay? Yes. Every part of the body, we grow. At some point, we stop growing. There are signals in the body that tells the tissues, the parts of our body, to grow and to stop. And if you do realize, when you have a cut on your body, even when a piece of flesh is missing, the body kind of like signals that tissue to start growing back. When it grows back, when it gets to the point where it's normally supposed to stop, it stops. It heals and remains at that level. However, what happens in cancer is that the normal regulation, the normal way the body is supposed to get that signal to grow and not to grow, is destroyed in those tissues. So what happens is that they no longer respond to that signal to stop growing. So with that, when that part of the body starts to grow abnormally and is no longer being regulated by the body system to stop growing, it can grow to any level. It grows till the point that it crosses its own natural boundaries. For instance, if a breast cell, which is the smallest unit of our life, which is called a cell, malfunctions like that and is no longer receiving those signals, it becomes cancerous. There are things that trigger it to become like that. Sometimes genetics, but we'll get to the causes. But when it happens like that cell becomes abnormal in that sense. Normally, cells grow and they die. But when a cell becomes abnormal that it cannot die, it can no longer receive signal to stop growing, it starts to multiply and keeps multiplying. There's nothing that can stop that growth at that point. That's the body's normal regulation cannot stop it. So it keeps growing to the point that it starts entering into other tissues because it cannot be regulated again. So it starts entering into other tissues. Sometimes if it's coming from the breast, it enters right into the muscles of the chest, into the bones, and then it can also dislodge and move to different parts of the body. So you'd hear things like, when people are discussing cancer, things like metastasis or distant metastasis. That simply means that cancer has left the original area where it started from and moved to different parts of the body. For instance, breast cancer can go to the backbone. Naturally, breast is not supposed to reach there, but the tissue from breast cancer can go there. Lung cancer, cervical cancer can get to the lungs. That's a form of metastasis. It has spread to the lungs. So you hear cancer has spread. So essentially, that's what happens in cancer. And when these things start to happen, when it starts to grow it enters what we call lymph nodes and starts to spread. When these things happen, it takes more nutrients, it saps the owner of the body, right?
Yes.
And takes the nutrient and now causes the person probably to die.
All right.
Okay? Yes. And it can also cause a lot of symptoms and malfunctioning of the body because of this abnormal behavior.
Okay. Now, Dr. Okpeh, is there something you would like to add to what your colleague pointed out about what constitutes cancer?
Okay, basically, it's just to add that cancers are generally a genetic mutation, just as she has said, a genetic mutation of normal cells. So once those normal cells become mutated, it now begins to proliferate or grow abnormally without control, causing diverse symptoms that we are going to look at. So it's all about a normal cell mutating and then beginning to proliferate or grow abnormally.
All right. Now, Dr. Ben-Ameh, what are the common types of cancer we have available medically?
Well, I'd like to state that cancer can affect any part of the human body.
Okay.
Any part of the human body you can think of, cancer can affect. But commonly, worldwide, we have cancers such as lung cancer, being quite common. Colon cancer, that's cancer of your intestines, also being common. Then, like we hear very frequently, breast cancer, affecting women, but also affecting men, affecting women more, but also affecting men. We have cancer of the cervix, which I'm sure our listeners have heard us talk about frequently. We have cancers affecting the eyes. We have bladder cancers. We have stomach cancers. So like I said, it can affect almost every part of the body. But most common ones, lung cancer, stomach cancer, breast cancer, cervical cancer, prostate cancer. And in children, we have cancers of the eye like retinoblastoma, cancer of the kidney, like what we call the Wilms tumor. Those are common cancers that we have around.
Okay. Now, Dr. Ugboaja, having identified some of these types, what are the risk factors? When we talk about cancer, what could constitute to be the risk factors for them?
Okay. So by risk factors, we mean the things that make us likely to have cancers. So the risk factors for cancers are many, and sometimes they are specific to the different types of cancers. But on a general note, there are things that we can change about ourselves and things we cannot change about ourselves that can make us at a higher risk of having cancers. For instance, the things that we can change about ourselves are things like our genes, our inheritance, hereditary. So when somebody is born from a particular family, there are things that one inherits from that family. And when this happens, like some people have inherited breast cancer genes, some people have inherited the tendency to have things like ovarian cancer, endometrial cancer, things like that. So you see some cancers running more in some families, all right? So those people in those families, if you have a close family member, say mother, father, sister, brother, grandmother that had a cancer, you should be more, sensitized to looking out for issues around that area. So another thing we can't change about ourselves is our age. There are cancers that are common with children. There are cancers that are common with, older ages. More likely, more cancers come as we get older. That's on a general note. But like she mentioned, there are some cancers, like she mentioned, retinoblastoma, the kidney cancer, Wilms tumor, that are common with children. Then there are cancers that as we go older, from 40, for instance, colon cancer becomes more common. Okay?
Yes.
Between 35 and 55, things like cervical cancer become more common. So as we get older, ovarian cancer becomes more common. So it's just like that. There are cancers that as we get older. There are also cancers that can come anytime. Some of these leukemias, blood cancers, can come to different people at different times. Some of this, what I can say about things we can't change about ourselves. But the things we can change, there are things about us that make us at risk. These are lifestyle factors. For instance, things like obesity, things like lack of exercise increase our risk. Also, when you look at also issues about our habits, for instance, sexual, something like human papilloma virus or hepatitis B virus, which will increase our risk. For human papilloma virus, it will increase your risk of having cervical cancer or cancer of the penis. But something like hepatitis B virus will increase your risk of having something like liver cancer. All right? So things like that exist. There are some blood, things that are passed that increase our risk. Having something like HIV also can increase our risk of certain cancers like Kaposi sarcoma and things like that. So there are things, about us already that increase our risk. Now, if you also look at it from the point of things like sun exposure, there are what we call carcinogens, in the environment. These are things that maybe chemicals, physical components in the environment that may increase our risk of having cancers. For instance, people who work in dye companies come in contact with certain dyes that can increase their risk for cancers. Historically, there are people who do the chimney sweeps they have increased their risk for scrotal cancer. People who work in some environment that have some kind of things that, impurities in the air a lot, can also increase risk of lung cancer. Smoking particularly can increase the risk of lung cancer particularly. But smoking generally increases the risk for every cancer. Okay? Most cancers, their risk is increased by being a smoker. Mind you, when I'm talking of smoking, I'm not talking of only the person who puffs. I'm also talking of the people who are in the environment of the smoker. Those are passive smokers. So when you are sitting with a friend or friends who smoke, you are inhaling part of their smoke, you're also a smoker. All right? That's very interesting, isn't it?
Yeah.
Then another thing is things like the sun. The sun increases our risk for cancers. Too much intense sun exposure, that is why we're encouraged to use things like sunscreen. All right? So when we get into, we should wear things like hats, especially people like albinos who don't even have this melanin. This is what the brown coloration in our skin is supposed to help to protect us a bit from the harmful rays of the sun. So sometimes, unfortunately, many of us bleach. We remove those helpful components of our skin that help to prevent cancer. So the sun can be a carcinogen.
When you mentioned the sun, everyone should be worried here because on a daily basis, almost daily basis, we're exposed to the sun. And of course, Makurdi, the sun in Makurdi seems to be
intense.
Very intense. Someone remarked that sometimes it feels a part of hellfire is leaking in Makurdi where the sun is intense. So, which is to say, will in Makurdi are really at risk of cancer?
Oh, well, like I said, especially albinos.
Okay.
Because that protective part of us that makes us brown, they lack it. The melanin, they lack it. All right? So it makes them more at risk. That is why you see that albinos have increased risk of having skin cancer. But this skin cancer can come to anybody, actually. But so we must try to also protect ourselves to, reasonable degree from very direct rays. Already we wear clothes, but people like albinos should always wear hats to help to wear clothes that reflect the sun, like white clothes, bright clothes, not dark ones like black. So these things are things that people should wear sunshades sometimes when they are under the sun. There are things that you do generally, wear sunscreen, that help to reduce the impact of the sun on the skin.
All right.
Yes.
Now, Dr. Okpeh, we have identified these cancers. Let's isolate a few of them and talk about them. One of which is cervical cancer in women. Help us understand the risk factors for it and maybe early signs and symptoms that one can detect to be cervical cancer.
Okay. Cervical cancer is second to breast cancer as the commonest cause of cancers in women. But the prevalence of breast cancer globally, we know is 2.3 million cases globally, and Nigeria the prevalence is about 54 cases per 100 women. And then is second to breast cancer, which is the commonest cancer. And cervical cancer is a cancer in layman's language, is a cancer that we find at the mouth of the uterus. Is a cancer that occurs at the opening of the uterus. Okay, let's say womb, opening of the womb.
Okay.
And then the risk factors, just as she has mentioned, could be genetic or it could be environmental. So, but the genetic factor for a lady whose mother is seen in women whose mother has had cervical cancer, there is a family history, is a strong risk factor for cervical cancer. Other risk factors include early coitus, a young lady that engages in sexual intercourse early in life is at risk for the cancer. A woman that has multiple sexual partners is at risk for cervical cancer. A woman that has had multiple deliveries or pregnancies is at risk for the cancer. Other risk factors include lifestyle, like cigarette smoking. A lady that smokes cigarettes is at risk. Inactivity or sedentary lifestyle can predispose a woman to developing the cancer. And then a woman that has a husband that has multiple partners, because it's sexually transmitted, basically, is also at risk for the virus, which is the human papilloma virus. Alcohol ingestion, excessive alcohol ingestion is a risk factor for cervical cancer. Then diet, fatty diets, obesity, age, increasing age can also be a risk factor. But basically, since it's sexually transmitted, any woman that has engages in sexual intercourse early and then late cessation of intercourse is at risk for cervical cancer. And then the race.
So let's look at the signs, early signs for detection of it in women. What are the basic signs?
Some of the signs that a woman experiences. One, if she is having intermenstrual bleeding, maybe you see your menses once in a month and you start seeing the menses coming, intermenstrual bleeding, frequent menstruation is a warning sign. And then if she's having foul-smelling vaginal discharge, basically for a lady that is having vaginal discharge that is foul-smelling, it could be other causes, but it's also an early sign of cervical cancer. Then for a woman who has attained menopause, that is actually not menstruating anymore, if she begins to notice vaginal bleeding, is a warning sign for cervical cancer. Then for after intercourse, after a woman meets with her husband and she begins to see blood, having postcoital bleeding after intercourse is an early sign of cervical cancer. So basically, it includes having foul-smelling vaginal discharge, a woman that has attained menopause, seeing blood, postcoital bleeding, and then cervical discharges. They are all signs of cervical cancer. But once the cancer progresses, late stages, it can spread to other organs, and that's when we begin to have signs of metastasis, which is unlimited. Once it begins to spread, it can lead to weight loss, it can lead to cough, it can lead to fatigue, it can lead to different signs of metastasis, difficulty with breathing, and then spread to other organs, which can be limitless. But specifically for cervical cancer is the ones I've mentioned. But if it spreads, it can go to any length and cause different signs and symptoms.
Okay. Dr. Ben-Ameh, is there something you would like to add to this concerning cervical cancer, the causes, maybe symptoms in women for early detection?
Well, I usually say when you begin to see something, then it has gone far. So the best time to pick cervical cancer early is through screening, because there are things we see without you knowing that there's anything wrong at that stage. And that is why we encourage women to make sure they are screened for cervical cancer at least once in 3 years. Because by the time you start having the symptoms my colleague has listed, then that cancer is established. And that is the point we don't want to get to. We want to be able to catch it when the cells are just beginning to change, so that we can institute management and prevent the devastating effects of the cancer. So that is one important point I would like to add to what my colleague has said.
Okay, now, Dr. Ugboaja, I'm back to you, and let's look at breast cancer. Breast cancer, according to, help us understand.
Okay, thank you. So in the early stages, they don't have symptoms. It's as simple as that. So most times, people don't even know that they have cancers when it's early, okay,
yes,
for most cancers. So same occurs with the breast cancer. So with breast cancer, usually we would always suggest that people go for screenings. There are things that increase the risk of a woman having breast cancer. Women who have family history, people in their family have had, let's say their mother or, close relations have had breast cancer. Mind you, breast cancer is not only for women. Men also have breast cancer.
Okay.
About 1% of all breast cancers is in men.
Oh, really?
Yes, it is. So men also have breasts.
Yes.
So they can have cancer of the breast.
And anyway.
Just that it's more of a women's problem.
Okay.
Okay? So 99% of breast cancers are in women. So that is why it wears a feminine face. So breast cancer, I had already established, is best you keep screening, you keep checking, especially when there's a risk factor. Well, from time a woman is up to 40, she will actually be having what we call a mammogram. A mammogram is a specialized form of X-ray that is used to check the breasts. And a mammogram can pick a breast mass, a breast cancer, before your hands can pick it. Now, going to the second level, another type of screening, checking, right? Screening, particularly when we say this screening, it means doing a test in an essentially normal person. So it's not when someone is already sick or having symptoms, you say you're screening. No. The person who looks normal, is feeling nothing, is the person who is screened. So women who are up to 40, if you have a family history at 35, you should have started checking. So from 40, every woman should be going for mammogram. Then the next thing you can also do, because a lot of we are living in an area where we don't have a lot of equipment at our disposal. It will be difficult to tell a woman in Bajimba or a woman in Gatu to go to do mammogram. But there's something they can do, even in the comfort of their bedrooms, without going to the hospitals. Their hands. There's something we call breast self-examination. So a woman can check her breasts systematically. They will check every part of the breast, including the armpit side, because part of the breast enters into the armpit. So you check it every month, especially if a woman is still seeing her period, especially immediately after her period. It's a good time to check because the breast tissues are softer and they're easy to check. But when it's closer to her period, it's harder to check, okay? So because it's a bit lumpy and full. So immediately after the period, all the hormones are down, you check, it's easy to pick something. For a woman who is no longer seeing her period, she can just pick a random date. Maybe she can say, 1st of every month, I will check my breast. Or maybe her birthday is 5th of something. She will say, okay, every 5th of every month, I will check my breast. So that's a good way of doing monthly breast self-exam. Okay?
Yes.
Yes. So then there are also people who those are the common screening methods that we can say in that are available to us. Something like mammogram I think can be done in the teaching hospital in Makurdi. I think there's some private facilities too. Air Force Base too can do it, mammogram in Makurdi, and also different parts of Nigeria. I'm sure this is a program can get to people from all parts. So everybody should, any woman who is up to 40 should try to have a mammogram. And also
detecting the lumps in the breast, as you pointed out. Are there other signs that if you notice, it could be likely that breast cancer is the issue?
Okay, so in doing this breast self-exam, actually what you're looking for are lumps. First of all, let's talk about looking at the breast. Because every woman, part of breast self-examination is to stand in the mirror and look at yourself, to look at your breast, look at your body. Because just by looking, you can see something. So now when most women's breasts are not exactly the same size anyway.
Okay.
So not exactly, but they're close. So when the breast starts changing size, for instance, you are noticing an increase in the size of your breast or a difference in the shape of your breast. You understand?
Yes.
Feeling something like a bump somewhere, looking at it, the shape is distorted. It may be a sign. Looking at the surface of the breast, the skin looking like an orange peel can be a signal. Okay, it's no longer smooth the way the skin is supposed to be. It's now dimpled, like you know how orange skin.
Yeah,
skin
with
is,
some dotted points on
so
it.
that's it.
Okay.
Then also looking at your nipple, maybe your nipple used to come out before, then suddenly it's becoming flat or going inside. We call it nipple retraction. It can be a sign that something is going wrong with the breast. Also looking at the skin, you know, there's something we call puckering, like that skin now squeezing up or going inside, like indenting inside. Now that can be a sign. So instead of being a smooth outline of the breast, some part of the breast is, or even deviating, the nipple will be deviating to one side or the other. Now, if you touch the breast, you can start feeling like a seed that didn't used to be there. Okay? It can start from a tiny one to bigger and bigger. It grows. Now, most times the breast too, I want to say something interesting about the breast. The upper outer part of the breast, up to the armpit, contains more than 50% of all breast cancer. So we must be very careful when we examine it, to examine that part very well.
That's the upper part.
Upper and outer.
Okay.
Close to your shoulder.
Yes.
Close to, upper and outer part of the breast. So these things are things will now start to ring a bell that something may be, a flattening of that nipple, something that looks like a rash on the nipple or on the skin of the breast. Those things can be signs. Now, if you also press the breast and start seeing some discharge, any woman who is not breastfeeding should actually see nipple discharge. Especially when you start seeing something like bloody discharge, okay, coming out of the nipple, it can send a signal that something is really wrong here. So these are the signs that we may see that may tell us that something is going wrong, which may be a cancer. But the next thing to do is not to panic and say, oh, I have a cancer because you felt something. It's to go to a hospital to get checked. Now, apart from those first ones of mammogram and breast self-examination, there's also what we call a clinical breast examination. Now, the clinical breast examination is now done in the hospital. If you notice something in your breast, or if you are doing your annual checkup, you can also have a clinical breast exam done. Clinical breast exam is done by a professional, a doctor or a trained nurse, to do that in patients. So they do it systematically, check your breast, just a form of examination to know whether everything is still all right with this person.
All right. Now, Dr. Okpeh, there are people who say husbands, women that are married, their husbands can also help them in checking. Maybe because this is a sensitization program we are doing. Let's educate the men on how to help their spouses in proper examination, self-examination of the breasts, so as to ensure early detection of cancer.
Okay.
That's
like a social.
No longer a self. It's no longer a self.
It's an assisted.
Okay, it's assisted.
Yeah.
All right.
But the woman can actually be the best person to actually do it when the breast is soft.
Okay.
And then the husband can also support.
Okay.
It's not self-breast anymore. Breast self anymore. It's an assisted thing. But
Okay.
generally, to examine the breast, just like my colleague have said, a woman can stand in front of the mirror and observe, having undressed, observe how the breast looks, because you look, then you touch and you feel. And so once she observes what the breast is looking like, it's advisable to go quadrant by quadrant. It's not just to examine the breast haphazardly. So she should have it at the back of her mind that it will be more organized to go quadrant by quadrant. Having observed, sometimes she can put her hand on her hips, look at the shape of the breast and the changes. Then we can divide the breast into 4 quadrants. It can be the upper and the lower quadrant, the outer and medial, left and right. Let me use left and right, but medically, inner and outer is clearer. So the breast can be looked at as being divided into 4 quadrants. That's the upper and the lower quadrant, the inner and the outer quadrant. So she can use the palm, the pop of her fingers. And using that pop, she will go from the inner upper quadrant and then try to palpate, rub the breast, and be conscious of trying to look for an abnormal lump. Because generally women have some kind of lumps, especially when we are breastfed. But once she's going with the pop of her hand, she can examine and check if there's any abnormal lump or swelling that sometimes can come like a groundnut seed or a small swelling. Then if there is nothing in the upper inner quadrant, she can go to the lower inner quadrant, then go to the upper outer quadrant, then the lower outer quadrant, then come to the nipple, the middle, the nipple, and also examine the nipple. Having done that, she can now try to squeeze the breast and press if there is any form of discharge coming out from the nipple, and observe. If there is no discharge, fine. But if there is any form of discharge for a woman that is not breastfeeding, just like we've mentioned, is a warning sign. And for those that already maybe have a lump and they are seeing any kind of discharge, especially if it's bloody, it's already a warning sign, because over 70% of lumps in the breast are usually benign. Those are lumps that are not they are not cancerous. They can't lead to cancer. So having a lump in the breast does not mean that. Most cases is just a benign lump that if they present to the hospital and they are clinically examined or checked, they will just need maybe a follow-up test like a breast ultrasound scan or mammogram or whatever to get to the root of what that lump is, so that they can handle those lumps early. And most cases haven't done a histology. If we take for further assessment, they are usually benign and can be cured. So basically it's to go quadrant by quadrant and then get the breast examined to know if there's any.
Okay, Dr. Ben-Ameh, is there any comments you would like to add concerning breast cancer, its examination and ways of managing it generally?
Well, I just wanted to agree with you that men could be of help in helping their women examine the breast.
Okay.
I've heard many patients come around and say, my husband felt something. So sometimes the men are actually more observant than their wives. Okay. So if husbands are open to doing it, why not? They should just follow the systematic method my colleague has talked about. I think my colleagues have said most of what should be said about breast cancer. Examine yourself, know your breasts. I always tell women, know your breasts. Nobody can know it better than you. Exactly. Some people shy away from looking at their bodies, but that is where it starts. That's the only way you can know when something is wrong, is by knowing what is right. So know your bodies, check your bodies monthly to see if there's anything that is amiss, so that you can get care early.
All right. Dear listener, if you are just tuning in, you are listening to Perspectives on Agate Radio 95.5 Star FM Makurdi. This morning on the program, our discussion is focused on sensitization on cancer in relation to World Cancer Day, which was observed yesterday, February 4. And I have here in the studio with me a panel of medical experts who are giving insights on the subject matter we are discussing about cancer in general. And at 10 o'clock, we have VAU, the line through which you can call in on the program. That line is 0814-335-9292. 0814-335-9292. We'll start taking your calls at 10 o'clock. Meanwhile, the SMS line, which is also available on WhatsApp, and you can participate on the program using it, is 0912-699-9404. The line for SMS, once again, is 0912-699-9404. Kindly remember to include your full name and the address where you're sending your message from. Now, Dr. Ugboaja, let's talk about prostate cancer. This is cancer that is common in the men, right? Mm-hmm. And help us understand what prostate cancer is, ways of detecting it, early signs and symptoms.
Okay. Prostate cancer is a cancer that affects only men.
Okay,
Just
why should breast cancer affect women and men, and then prostate is only for
Okay,
men?
but
Don't
the
mind
cervix affects only women.
me. All right, don't mind me. Okay.
So,
Yes.
just like we showed that breast and cervical cancer are common in women,
Yes.
prostate cancer is quite common amongst men, especially our kind of men. By that I mean black men.
Oh, wow.
It's more common among Africans, African Americans. And so, like I had earlier said before, there are things you can change, there are things you cannot. You can change your race, you cannot change your age, you cannot change your family history. You can change other things like your diet, your lifestyle, all right?
Yes.
Now, coming to age, from the time a man is above 50, from 50 and above, men are at increased risk. Meanwhile, the prostate, before I even get to that risk, the prostate is a small organ that is like a walnut. You know walnuts that
Yes.
we eat?
Yes.
It's about that size, but it's found at the neck of the bladder. You know, when we say prostate, it's good for us to understand what this organ is.
Exactly.
It's around, if you have where your bladder is, you know, down your belly.
Yes.
Yeah.
Lower abdomen.
At the lower abdomen.
Yes.
At the lower side of the belly, of the bladder, where it is now coming out, where the urinary tract starts, you know,
Yes.
you now have what you call the prostate surrounding the urinary tract. So the urethra, that is where urine comes out of, passes through the middle of the prostate.
Okay.
You understand what Dr.
Yes.
Joyce?
Yes.
And so that prostate stays there. It's doing its work. It produces some fluid, some juices from it that enter into the semen. It's part of what produces semen in men. Okay?
Yes.
The sperm cells will mix with some of the prostate fluid to become the semen that comes out. So it's very important in the reproductive life of a man. Okay?
Yes.
Now, what happens now is that with time, especially with age, from above 50, you start seeing that some women may start having an enlargement of that prostate. Sometimes the prostate maybe the part of the cell might malfunction, like we already established, as a cancer cell. And that's where the cancer of the prostate now starts. So when it starts growing, as it's growing older, bigger, you now find that it will start giving you some symptoms, because it will start pressing on that urethra that is passing through. You know, as something is getting, it's also squeezing that part. That's what will lead to some of the the symptoms I will mention later. But now, coming back to the risk factors. The risk factors, like I mentioned, the age, from 50 and above, you have increased risk. People that have, like black men, like I mentioned, people that have somebody close in their family, especially if you had prostate cancer before 60 years, there's a high likelihood that that thing is familial. Okay?
Yes.
So prostate cancer can also be in families. In fact, I have some people from my place there, up to 3 brothers have had prostate cancer in that family. Okay? Then we're looking at also diets that is high processed food, high fat diets, large red meat diets. But I dare say that many of us don't even get enough meat. So our diets may be a problem for those that have enough, you know, and also eating processed food. Then, of course, being overweight, obesity increases risk and things like that. Lack of exercise and all of that can be a risk factor. Other things that can be involved are people who also have a family history of maybe a woman in their family that has had breast cancer. The breast cancer can also be linked to prostate, yes.
Okay.
Yeah. So there are some genetic conditions, you know, breast cancer gene, BRCA1, 2, the Lynch syndrome, that includes even ovarian, endometrial cancer. Those ones, there are some cancers that may be found even across genders that may reflect on, because it's a genetic predisposition. Okay?
Very
so,
well.
Yes, so that is it. So essentially, there's also some carcinogens that increase the risk for breast cancer. Smoking, prostate cancer I'm talking
Yes.
about. Smoking also increases the risk as a lifestyle factor for prostate cancer. Now, about the symptoms of prostate cancer, initially the person may not feel much, because the truth is that enlargement of the prostate may be a benign one, the one we call benign prostatic enlargement. That is just an ordinary increase in the size of the prostate. Now, so the increase of the size of the prostate may be caused by just an ordinary increase or caused by a cancer. Now, which may bring some confusion in the symptoms. But when it starts happening, what happens is that you start having some urinary problems. You notice that a small boy can pee, and then pee will be flying to the moon, just going way up. But as one is getting older, what happens? The urine distance can start dropping. Sometimes it gets to the point where the person pees and looks like he cannot pee out everything. He cannot urinate out everything. Sometimes it dribbles at the end of the peeing. It's not supposed to dribble, it's supposed to cut. When you finish urinating, it ends. And some people have to, whip their penis, to get out everything. It shows you that something may be happening at the level of the prostate. But I'm not saying that must be prostate cancer. But those are things that give you an inkling that something may be happening. Okay?
Yes.
Then sometimes when they are now urinating and they are forcing the urine, it's like you're struggling to urinate. It's like you have to strain to urinate. Another thing that can be a sign may be seeing blood in the urine. Okay? When you are urinating, then you start seeing blood comes out with it and all that. So those things are the prompt. Sometimes you now have urinary retention. Because the urine, you try to urinate, you don't empty everything. Small time you want to urinate, small time you want to urinate. So with time, you may be having backlog of the urine. And at a point, it may become so much that the bladder becomes very distended and causes some pain. So that's what we now call urinary retention, which may be, there are different ways it presents. So essentially, these are some of the ways that prostate cancer will present. Then as it's going even further down the line, you may now start having other things because of its spread. Okay? The prostate cancer can deposit in different parts, especially bones. It can actually make the bones even more fragile to break easily. Okay? And deposits, in everywhere, even in the brain. So many, any part of the body, So these are things. So how can we detect prostate cancer? There's a screening that can be done for prostate cancer. Prostate cancer can be screened for by doing what we call PSA, prostate-specific antigen. It's a particular part, like a chemical that our body releases from the prostate. When the prostate is too active or, getting to that point where it's a problem, it now rises, it starts to rise. So normally the PSA of men should be between 1 to 4. If it starts 0 to 4. 0 to 4. So by the time it starts getting above that, it may be that you are enlarging. By the time you're even getting up to 10 and above, it may be pointing to a cancer. So that is a screening tool. Another way we screen is also by doing what they call a digital rectal exam. Okay?
Yes.
So that digital rectal exam is a doctor that will do it in the office. He puts a hand to check the prostate. In checking the prostate, he looks at the size of the prostate. The way the prostate shape is can give him a lot of information. Okay? Because when it's cancer, it becomes very bumpy, hard, and other factors. So there's a way the doctor will determine that this thing is enlarging and is likely a cancer. So that is that. Another thing they can do is a prostate ultrasound. I forgot to mention, even for the breast, you can screen by an ultrasound For places many of us don't have access to mammogram, you can use an ultrasound. So there's also a form of ultrasound that can be done to check on the prostate. With that, many people can pick that something is going wrong with this. After the screening level and you think that there's an issue, you will go further for a diagnosis. Now, for this diagnosis, you will do what they call a biopsy. Biopsy means picking tissues, small pieces of the prostate. They go take little bites, little pinches of the prostate, and go to a special lab for what they call biopsy, right? They check it under the microscope and see whether there are cancer cells. Biopsy is also very important in diagnosis of almost all the cancers. You can, in fact, all of them, you should be able to have a biopsy that tells you categorically, this is this cancer, this is the subtype of this cancer. And even, the diagnosis can go beyond that to tell you even the genetic type of the cancer. So that is how we can find out.
All right, we are due to start engaging with the listeners soon enough, but Dr. Okpeh, I will allow you just a few minutes to add if you have additional information to share on prostate cancer, as maybe some of the points raised by your colleague, your panelist.
Okay, basically she has mentioned most of the clinical signs and symptoms and diagnosis. So basically, we always preach prevention, which is always better than cure. So generally, a man that is 40 years and above should avail themselves to do a serum prostate-specific antigen check, a PSA assay, very important. We encourage them, once they do that test, if it's more than the normal, it will give a pointer, because once it is picked early, it can be medical treatment. Not all cases the doctors will recommend surgery. So it's very important for men to do routine screening of their serum PSA. We can also request for an abdominopelvic ultrasound scan, taking note of the kidney, urethra, and bladder, to ensure that the prostate around the bladder is not enlarged. So that once there's a sign showing that there is an enlargement, they can either, if it's beyond a medical management or drug treatment, they can quickly do a surgery to get the prostate out, because a man can live without the prostate, just like we can get an appendix out, to prevent the spread. Because once it spreads, we all know that cancer is something that once it's in somebody, is just God. It's just like a death sentence. If you don't detect it early and it has metastasized, it becomes a problem. So we always preach prevention, which is always better than cure. Additionally, if someone is having a burning sensation and pain during urination, in addition to all the other symptoms she mentioned, it can be a pointer that something might be wrong, if it's not just a minor urinary tract infection. But early detection will go a long way to help manage someone who is having symptoms urinary symptoms or symptoms pointing to a possible prostate benign or carcinogenic condition around the prostate.
Okay, Dr. Ben-Ameh, you were also itching to say something on this. Please do so quickly so that we can engage.
Yeah, I just wanted to mention that a lot of the cancers we've talked about have to do with parts of the body that we culturally and morally see as private parts. The prostate, the cervix, the breast. And that has come to bear in how early people come to the hospital, because we tend to hide what is happening in those areas until they are unbearable. And that is why we are here today, to say that if you have any problem with those parts, your breast, your cervix, your prostate, any part of your body that you may think is private, and you sit at home with it, it makes the job of your caregivers, the doctors, more difficult, and your chances for cure less. So if anyone you know or you yourself has that kind of problem, please come to the hospital privately, and your matter can be addressed on time so that it doesn't get bad.
All right, we'll take a short breather, and when we are back, welcome back from that short break, dear listener. Thank you for staying with us on the program. Or if you are just tuning in, this is Perspectives, and we are having a sensitization on cancer in line with World Cancer Day. You can phone in on the program on 0814-335-9292. Once you connect with the studio, we would like to know your full name and where you are calling from. Keep your submission very brief. Good morning and welcome to Perspectives.
Good morning, Nathaniel.
Thank you for joining us.
Good morning, you doctors.
Good morning.
Good morning.
My name is Alphonsus Okeke.
Thank you, Alphonsus.
Alphonsus Okeke.
Yes.
Nima.
Okay, sir. Welcome.
What I want to report, like say, if I did travel, if peace,
Hello,
they
sir.
worry me. If
Sir?
I did travel,
We can hear you. We can hear you quite okay, but your radio set is interfering. Maybe you should turn down its volume so we hear you better. Go on. We are listening to you.
I say, my problem, if I did travel now, if peace, they will worry me. If driver no stop that time, I will peace. If you waste time, anytime I want to peace again, the thing will pain me. Before the peace will come out, it will pain me. What is the problem? Do you understand me?
Yes, sir.
That is all my problem.
Okay, sir. Thank you. We appreciate you for calling in. The doctors will respond to you.
Thank you.
Thank you, sir.
Okay.
Okay.
Thank you, Alphonsus.
Yeah, let's engage with more people. We'll note the concerns when we come back. We'll start engaging with them and responding one by one again. 0814-335-9292. The SMS line is 0912-699-9404. Okay, now maybe we should hello, good morning. Oh, we lost connection with you. But the line is still available, 0814-335-9292. If you're not able to connect to the line, simply send us an SMS to 0912-699-9404. Good morning and welcome to the program. Oh, it does appear there is a network glitch, maybe. But yesterday, the Labour Congress shelved their planned protest, so the telecom operators should allow the network to be stable. Good morning and welcome to the program.
Hello, good morning, sir.
Thank you for joining us.
Good morning, the doctors in the studio.
Good morning.
Morning.
Yes. My name is Timothy. I'm calling behind a Gate Production.
Timothy.
Direct opposite Commissioner's quarters, Timothy Dogo.
Okay, Timothy Dogo, go ahead.
And sir, I really appreciate the present government of Benue State now. You know, before you go for the cancer test, you travel to Lagos, you travel to Jos. And if you want to travel from here to Lagos, look at the transport. So you can even start your treatment. So the present government now has machines that is testing the cancer, cervical cancer, and the prostate cancer. So I really appreciate the present government now.
Okay.
If you go to the university teaching hospital now, there is a machine that is you can test a cancer, even cancer of the breast. So I really appreciate. I'm just calling to appreciate our.
Thank you, Timothy. We appreciate you. Thank you. Okay, that's fine. We're happy that we have that on ground, even though the doctors confirmed that it has always been there. But that's okay. We appreciate your commendation for the government. Thank you for calling in. Hello, good morning.
Good morning, sir.
Thank you for joining us on the program.
Brother Emeka calling from West Africa.
Good to have you join us, Brother Emeka.
Yeah, I greeting to your guests in the house.
Thank you.
Okay, on the lighter note, Nongu, you didn't follow the Beijing conference. No man among them. Not on the right hand.
Why are the men quick to complain? We have always had on this program an all men dominated discussion panel. So today we have women, and they're doing justice to the subject matter, talking about men.
I'm just on a circular note.
All right, Emeka, don't worry. Go ahead.
Okay, some of the factors they mentioned interested me, like the lifestyle factor. So they don't know whether there is sensitization along that direction, because one of the panelists mentioned something about chemicals and what we eat and our lifestyle. So that area is of interest to me. So I wish there will be more sensitization on that aspect, because our food stuff now is full of chemicals, here and there. We should go back to the way our forefathers, ate, live more naturally as possible. Then my own interest in this prostate cancer thing for men. I don't know whether they will do more like, what is prostate all about? Don't know whether they.
Emeka, maybe you are just tuning in. We had, that was just the subject matter we finished discussing, and then we went into the course. Were you just tuning in?
Oh, I was listening, but I went off at some point, so I just came back again.
Okay.
Anyway, I don't know whether I discussed that. This process of it, I used to hear of it, but I don't know much.
Okay, we'll do a refresher on that as we go along. Thank you, Emeka.
Thank you so much.
Yeah, have a great day. Okay, 0814-335-9292. The line is still available. You may have a question or you may have a contribution on the subject matter of cancer, calling on the program. The line is 0814-335-9292. SMS line is 0912-699-9404 if you're not able to connect to the call line. Hello, good morning.
Yes.
Good morning.
I am Nathaniel Lazarus. I am calling from Okpeh.
Okay.
Local government.
Thank you, Nathaniel.
I appreciate you for the topic today, and the guest is you've come out of my break. It's a very big problem. In fact, I will not see any pain. That's my problem. Thank you very much.
Okay, Nathaniel, thank you. We appreciate you. We'll speak to your problem. Thank you. Okay, we are still here. I think we should respond to some of these concerns. Almost Alphonsus Okeke and Nathaniel's case seem to be related. But before that, let's we'll just hang on a bit. Hello, good morning. Hello. Oh, lost connection already. Okay, Dr. Ugboaja, speak to the concerns raised by Alphonsus Okeke and Nathaniel Lazarus.
Okay, thank you. Alphonsus Okeke was talking about sometimes traveling and wanting to urinate, and if that is not attended to immediately, he now has difficulty passing the urine when it's time to do so.
And pain.
Yeah, and pain. While Tatenge is similar, but Tatenge is saying that he doesn't have pain. He just has difficulty passing urine, pushing out the urine. Now, while it is important for these men to also go to the hospital to get checked out, because there are questions that must be asked to them, some things that the doctor has to understand in order to be able to help them. But I want to say, because of to be delayed, when you want to urinate, one of them, like I already mentioned, is prostate issues. Now, but I also mentioned that the prostate issues are not only prostate cancer. So the person needs to get to the hospital to check what exactly is going on with him. And the earlier things are detected, the better they are, they will be treated and it will be resolved. So there are many things like the benign enlargement that we talked about, the one that is not a cancer. There is the cancer of the prostate. There's also what they call prostatitis, like inflammation. Can also cause pain and difficulty in urinating. Okay? So, but even urinary tract infection can cause that. So we cannot sit here now and particularly determine exactly what is causing him to have those problems. All right? But it is a red flag, as we have already established, especially when we are looking at older men. And I believe these men are older men. Once you're up to 40 and above, and you're having symptoms like this, you should get to be checked out. So that's it. Then the other person was also asking, I think that was a Emeka that was talking about sensitizing, also sensitization, increasing sensitization on lifestyle, especially about food factors, the way we eat, patients that have cancer. But like I said, this cancer thing has many factors involved, but the ones we can take care of, like our lifestyle, we really need to be, step up our game. As a rule, the way I used to say it, natural foods are better. Okay, natural foods. Food that look like the way they came from the farm. They are better foods to eat. So like you said, the way our forefathers used to eat the food. You fetch vegetable from the garden, you know what it looks like from a tree. You eat it. You get a banana from a tree, you eat it, and all those things. Unfortunately, many of our foods are also being processed in ways and handled in ways that can be harmful to us. Like the good old apple that we eat. These days, people put even things like bleach inside to ferment it and all that. So we also need to be careful of our source of food. Some of the things that now are a source of concern for even the natural foods that we eat are things like pesticides. Okay? So if some of us can grow some of the vegetables that we eat, it may also help us. But on the other hand, some things we can't really prevent. We have to buy foodstuff. But when we're buying foodstuff, can we buy more of the natural looking foods than things that come from packets? Many people are now teaching babies how to eat by eating Indomie. Indomie is, you don't know what tree or what type of thing Indomie is made of. It's mostly chemicals and flour. Yes.
Anyway, so let's not dive into that. So we are not seen as demarketing
No. Noodles generally. I'm just saying noodles, pasta. These things are not natural foods. I'm looking at food generally that come from a packet.
Yes.
Meat that has been processed and stored in a can.
Yes.
Normal meat, if you keep it, it will get rotten. What do you do to meat to the point that you can put it on a shelf, not in a freezer? We understand freezer. The cold can keep it safe. What do you do to put it on a shelf? There are chemicals that are injected into these things. That's what we are worried about.
All right.
Thank you very much.
Okay, so I believe Alphonsus and Tatenge, I believe your concerns have been addressed. So we don't get to prolong the issue again. But the line is still available, 0814-335-9292. You may send us an SMS to 0912-699-9404. Hello, good morning. Hello. Okay, we lost the connection. But okay, now let's come back. Dr. Okpeh, the human papilloma virus, which you identified earlier, that is the virus responsible for causing cervical cancer. Is there a vaccine available for its prevention, and what stages should the vaccine be taken?
Okay, there are vaccines currently, and it's free for young girls. Even young boys can also have that vaccine and be protected from either cervical cancer or other forms of cancers caused by the virus, human papilloma virus. So currently we have free vaccines for young girls between the ages of 9 to 14 years. Okay.
Let me interrupt you briefly. We'll come back. Good morning.
Good morning, sir. How are you?
I am fine, thank you. Welcome to the program.
Thank you for this good program. I am Elder Daniel from Kanchi.
Elder Daniel.
Sir, from Kanchi.
Thank you, Daniel, sir. Go ahead, sir.
My question is that can the cancer, some, somebody who contracts a cancer through spiritual means,
True.
through spiritual means?
Okay, spiritual means.
Yes, sir.
Okay. Could that be all from you, sir? Okay, he's off already. Can somebody contact cancer through spiritual means? Anyway, Dr. Okpeh, let's
I'll try to be fast so we can get questions. So basically, we always preach prevention, which is always better than cure. So encouraging our young girls, mothers, don't think these human papilloma virus vaccines that are given free is actually free. Somebody is paying for it, but they are making it free so that our young girls will not suffer the menace of cervical cancer. So avail your young girls to get that vaccination, because once they have the vaccination, they are protected from the cervical cancers. So you can check any primary health care center. We have some in Api. We have, we can check at the EPID unit close to Dunamis Church, at the Benue State University Teaching Hospital, FMC Makurdi, where they take the routine immunizations. They can give free cervical cancer vaccine, either the Cervarix, the one available for young girls between 9 to 14 years. But our as elder, more advanced ladies, we can also get the vaccine, but that one you have to pay for it. But why we encourage the young ones is that once the vaccine is in them, it protects them from the cervical cancer. Medical Women's Association have done a whole lot. We've been doing over the years to do our little, shine our light in our little corners by encouraging women to come out for free cervical cancer screenings. So once you've done the screening, once we do the screening is done and you are free of the cancer, that's for those that are already sexually active. You can now get the vaccination to protect yourself. But if there are early changes we see, there can be interventions. So depending on the level we find, there are other tests that can be done. So basically, the women that are already sexually active can also have it, but it's better these young ones that most of them are not yet sexually active. They can be protected once they have that vaccine, and it's given in many of these immunization centers. And there are a lot of misconceptions proving that maybe if they have it, they might not be fertile, they might not be able to have babies. Those things are not really true. They should bring out their young girls to get vaccinated. Those that are already active should do a pap smear. Even if you don't hear of free cancer screenings, you can avail yourself for cervical cancer tests.
Okay.
A pap smear can be done, and once you are free, the next 3 years you go for another check, so that will prevent it before it becomes actually a cancer.
Good morning. Thank you for holding on.
Yeah, good morning. My name is Tehide. I'm calling from OGRA.
Thank you, Tehide.
Yes, sir. I want to, because one of our colleagues, contributor, just said, asked a question about spiritual. Somebody can get this in cancer from spiritual distance, because my sister was a victim of this. Can you hear me?
You are on, Tehide. We can hear you.
Yeah. Because on 2017, my sister got this cancer. She cannot urinate. She cannot go to the hospital toilet. Then she went to the hospital. She discovered that she has the cancer. She started taking her medication. Then she was getting better. She went to her church. I want to tell you this so that we should be very aware. We should be very careful with our pastors, because they are the one causing problems when it comes to our health. She went to the house at the church and she told her pastor. Her pastor said he saw this thing in ministry. He was sleeping. He saw a vision that she has a cancer. It's a spiritual something. Then my sister stopped taking her medication and she believed him, and she started taking going to church. And the pastor said she should be fasting. Someone that has cancer, she cannot do this thing. That she should be doing this thing from 6 to 6. She'll eat only in the night. Then, with all the prayer, with all the fasting, she passed on. So they should stop their this thing, because I was still angry about this. I lost my sister, who was so dearly to me, and she was like a mother to me. So thank you.
Okay, Tehide, we sympathize
Yes,
with
sir.
you over your loss. Thank you for
Yes, sir.
sharing your experience with us. Condolences. Thank you.
Thank you.
Okay, now, Dr. Ben-Ameh.
Yeah.
Certainly, I was going to come to the myth and misconceptions people have about cancer, but someone has raised a question about cancer, whether a spirit could be suffered spiritual attack. And now we have another caller sharing an experience. But before we respond to those, let's take this call briefly. Hello, good morning. Good morning. Oh, we lost connection with that caller. But now, speak to this. Speak to the misconceptions, myths surrounding.
Morning.
Thank you for joining us on the program.
Thank you. I'm Tezungwe Blessing calling from Achusa.
Okay, thank you, Tezungwe Blessing.
Sorry, like my own case, I went to the hospital for the screening of cervical, and they told me it was positive. So according to them, a treatment was made, and some little antibiotics was given to me that I should go and take and come back in 5 weeks time. I'll be 6 weeks time. 6 weeks time. So when I came back, they now said it has been cleared. So should I relax or should I go back for another examination?
Okay, but it was in the hospital. The person who told you it was cleared was a doctor, the doctor you submitted yourself to in the first place?
Yes.
Okay. It's all right. Thank you. Could that be all from you, Tezungwe Blessing?
Thank you.
Thank you. We'll get the doctors to respond to you. Thank you very much for calling in. Now, Dr. Ben-Ameh, you are speaking to us about the myth and misconceptions surrounding cancer, whether one can suffer it as a spiritual attack, as one of the callers is alleging or asking.
Yeah, I'm glad that people are giving, true life experiences. I sympathize with the second to the last caller who lost his sister to
Daniel.
cancer. Daniel, yes. I'm sorry that happened. The elder that called was asking if it could be spiritual. I'm sure that's because he has heard, so many people talk about cancer being spiritual. We are very religious. We are spiritual beings also. I like to say that. But we like to explain away everything we cannot explain as being spiritual. Cancer is a very difficult diagnosis to make and to treat. It's also very difficult to explain. So because of these characteristics of cancer, we in our society prefer to say it is spiritual because we cannot completely explain it. Many people who have cancer or who are on treatment for cancer are subjected to treatments for prolonged periods because, like I said, cancer is not easy to treat. So they are on treatment for prolonged periods and people get impatient with the outcomes. And so they would rather look for, fast ways of getting relief or getting a promised cure from other sources. And that is one of the things that perpetuates this myth that cancer is a spiritual attack. Another thing that perpetuates this is because people come in late. I keep emphasizing this. People come in late with their problems when it has spread and it's beyond what people normally see. And so this also prolongs treatment, makes treatment difficult, and people begin to say it is a spiritual attack because the drugs you're taking has not given you a fast cure. So I'd like to categorically state that cancer is a physical problem. It is physical. It affects the body, and we can see its acts. And there are drugs or therapies or means of treatment that can be used to either cure cancer or to minimize its effects on the person who is affected. So no, cancer is not a spiritual problem.
All right.
Okay.
Okay. You have concluded, right?
No, you asked for other myths, so let's hear. I think we have callers.
No. Just conclude your thoughts so that we can take on other issues.
Okay. Another myth is that cancer can be, contagious. Yes, someone can contact cancer from another person who has cancer. Now, this is not true. You can lie with the person who has cancer. You can eat with the person who has cancer. You can, live with the person who has cancer, and you will not contact cancer. That is not how cancer is spread. Mm-hmm. The only thing that may be spread in that way is human papillomavirus.
Not the cancer.
Not the cancer.
That's the virus.
The virus
which
itself.
Leads to cervical cancer.
Yes, so it spreads by sexual intercourse. Now, that can be spread in that way, but for most other cancers, you cannot contact cancer just by being near an individual who has cancer.
All right. So, Daniel, I believe we have answered your question. Who talked about cervical cancer and that she was giving medications, antibiotics, according to her, and that it is clear. Do you listen to her? So speak to her concern. Does she need to follow up? She said,
okay.
Doctor to
Dear Blessing and to other listeners, I'm very glad you went for the screening. You are one of the precious few that come for screening. So I'm very pleased to hear that you went for screening. However, maybe you had other issues, but usually we don't treat positive. I'm sure what they screen for is pre-cancer, not actually what you're looking for is a pre-cancer. So she might have been positive for the pre-cancer, and it was treated. Now, the treatment for pre-cancer is not antibiotic. Maybe there were other issues that made them to give her antibiotic. But the treatment for pre-cancer of the cervix is usually to burn it off with something. There are special tools we use to burn it off, or to cut out part of that side that is affected. All right? So I'm sure maybe they use what we call thermal ablation to burn it off, or cryotherapy to use cold, like ice, to freeze it off. So, but essentially, that's how it is treated. Now, for a patient who has been treated for pre-cancer of the cervix, the patient must still continue screening. That person should come back within a year, in about a year, for another screening. And the patients who are HIV positive, for a screening schedule for cancer of the cervix, should be screened every year if they are negative, and treated if something is found, because HIV increases the risk, like I had earlier mentioned, of having cancer of the cervix, and it also increases the progression, the speed with which a pre-cancer will become a cancer. Cancer of the cervix is very unique in the sense that it is one cancer that we have found ways of preventing it definitely. It's a cancer that no woman deserves to have. It can be totally prevented if we do the right things. She has already, one of my colleagues had already mentioned HPV vaccine. Giving our girls HPV vaccine is a very important part of our prevention. Also, preventing early sex and reducing multiple sexual partners, and also using some protection for sex. But I must also say here that even a woman who has had one partner in her whole life is still at risk. So that we don't go looking at cervical cancer as something for promiscuous people. No, because the woman might have had only one partner, but can she guarantee where her partner has been? So if you can get from A and give to B. But that is HPV. But note that HPV can be cleared by your body, but there are things that make it, the body less likely to clear it. And when it stays, it now starts changing the cervix to become a precancer, which will later become a cancer. But the good thing is that it takes a while, 5-10 years, even more, to transform from the HPV infection to a cancer. That is why we ask women, we plead, we implore that women should come for screening. Within that whole period, if you're screening every 3 years, you are likely to catch it at any stage when it is starting, the precancer, and treat it. And when it is treated, it is purely, the precancer is not a cancer, it is purely treatable, and the cancer will be totally preventable.
All right.
Yes. So cancer, we also have this message, one of the myths is that cancer is like purely a death sentence. I would say that that's a myth, because cancers can be cured.
Okay.
Okay? Yes. So especially if they are detected early. And that's why we keep asking for the screening to be done. Thank you.
All right, that's fine. Let's take some messages before we come back. This one says, good morning, presenter and guest in the studio. Please, I want to know whether there is testicle cancer, because there are some certain circumstances where one feel bigger or harder than the other. So I want to know if someone who has experience is safe. Thank you. My name is Manasseh Uja from Welfare Quarters in Makurdi. Manasseh, thank you. This one says, good morning, the presenter in the studio. My question is, whenever I want to urinate, I'm having pain. What is the cause of that? Where was it? Where was I say from IQ? Okay. I say thank you for your message. We appreciate you for sending it in. And from our WhatsApp box here, we also have a few messages. Okay, that's the same one that we took from text. Hello, good morning.
Hello, good morning, sir.
Thank you for joining us on the program.
I'm Nestor Ode.
The name is who?
Nestor Ode.
Nestor?
Nestor.
Okay, Ode. Where are you reaching us from?
I'm calling from Allen.
All right.
My duties to the doctor.
Thank you. Ode, your network seems very unstable where you are. Kindly change your positions. Let's hear you better.
Okay. All right.
Speak on. You are
Hello.
on. Go on.
Can you hear me now?
Yes.
Okay. Mostly of the symptoms that doctors have just named, it seems I'm experiencing mostly of them. Could it be it? I don't know, because as I speak, throughout last month up to date, I've been experiencing all kind of body pain, both in my chest, at the back. So even at my chest, I've been seeing something that says, how do you call it? I see something swell up there at my hips, at my joint of my the chest or the thing. So I can't even to sleep at night. It's so difficult for me. I don't know, maybe it can be probably the cancer. So,
okay,
and also, is it curable? That is my question that I want to ask.
Okay, Nestor, your network is very unstable, but anyway, we'll just try to make sense of what you said and speak to you. Thank you for calling in. Thank you. Okay, let's address the questions, beginning with the one raised by Manasseh Oja from Welfare Quarters. Manasseh wants to know whether there's testicle cancer. Is that not the same thing as prostate cancer, Dr. Okpeh?
No. Testicular cancer, it can be a cancer in males.
Okay.
And then the testis is found in the scrotal sac, in the scrotum.
Okay.
Yes, so if he's experiencing pain and maybe a swelling that is hard in the scrotal sac, I think the best thing he has to do is to come to the hospital, because most times it can come out as just a benign infection or inflammation of the testis, which is called epididymoorchitis. So not all conditions or swellings in the scrotum is cancer. That's why once they feel there is a swelling or lump, it could be fluid. We call it hydrocele. It could be that there's an infection, and that can go with fever and all. So presenting to the hospital will help the doctor after a scrotal scan is done, and after taking a good history, a scrotal scan is done, we'll be able to tell whether it's just an infection or it's fluid that is collected. And if it's a cancer, they will go through the various tests, and even a biopsy can be done. And if it's malignant cells, depending on the stage of presentation, for all cancers, it can be cured if it's early presentation. But if it's late, they can either go to the various management protocol, which can be either using chemotherapy or radiotherapy. But if it's early, it can be cured. But if it's late, it can just be conservative management with drugs by evaluation.
Okay. Now, Dr. Ben-Ameh, Nestor from high level, the network was really unstable. I didn't get most of what he said, but all I could surmise was that is cancer curable from the concluding points he made. Otherwise, he mentioned that it's having most of the symptoms. And we have talked about many of the cancers here. It was quite difficult to hear him, but speak to his concern. Is cancer curable?
Okay. Nestor, thank you for calling. I heard a few of the symptoms you mentioned, even though the network wasn't clear.
Yes.
And it's difficult to say exactly what you have. Now, we've mentioned here many times that many things can have the same symptoms.
Yes.
So there are a number of things the doctor will need to check on your body and probably carry out some tests on you to be sure what exactly is wrong with you. It may not be cancer, but you can only know if you come into the hospital. So I'd like to encourage you to go to a hospital so that you're properly checked, okay? And your fear would be hopefully taken away.
All right.
Yeah.
Now, you are a consultant ophthalmologist.
Yeah.
Early opening of this program, you also mentioned cancer of the eye.
Yeah.
See, growth around their eyes. Could that be cancer? And what should be early signs people should watch out for concerning their eye health in terms of cancer prevention?
Okay. Yes. There are a number of gory pictures on social media.
Yes.
And truly those people exist. There are a number of them in the hospital presently as we speak. And a number of them actually do have cancer of the eyes. And these cancers happen at different ages, but the ones that, are quite common now is that occurs in children, called retinoblastoma. It usually starts, early. You would find that the child instead would have this glow in the eye. I don't know if you've taken a picture at night on the camera and you see this glow, a yellowish or a whitish glow from inside the eye. When you look at the person physically, or when you take a picture, you see other causes, but it may be cancer. Another sign is when the child's eyes are not straight. They are not looking ahead or looking in the same direction at the same time. You have one of the eyes looking in different direction from the other. That may be a sign. Or the child's eye is just constantly red and tearing. That may be a sign of cancer. Or you have a child that is not seeing with one eye. You've noticed that if you close one eye, the child is unable to move or tells you that he's not seeing clearly with one eye. That may also be an early sign of cancer of the eye. But if it is left, to the later part, you may begin to see that the eye begins to grow out of the head and begins to protrude outwards. And if it's left, it can eat up most part of the face. So those are signs that the cancer has gone far. So what we usually encourage people to do is to make sure that when they notice anything wrong in their child's eye, they should not assume that it can be treated by chloramphenicol eye drop or any other eye drop from a chemist. If you've used that for 2 days and there's no improvement, please seek appropriate care.
All right. Now, Dr. Ugboaja.
Yes.
Let's move away from cancer and talk about its management in terms of infrastructure that should be there for cancer care in the country. Oftentimes we hear the government talk about cancer palliative management plan in the country, but the burden of it seems not to be going down. Is there the right investment in cancer care for patients in the country? If there is not, what more should be done?
Okay, cancer is, the treatment of cancer is across the spectrum. It's not just one thing.
Yes.
Drugs are used, surgery is done, and also the other parts which a lot of machinery needs to be involved, which is now radiotherapy. So from the chemotherapy part, there's what we call chemotherapy. That's the use of drugs for cancer. So cancer drugs are called chemotherapy agents. So these are special drugs. They are largely available, though depending on the environment. Some may be more available in some environments and some are not. The surgery, and I think it will depend on the type of cancer and the doctors that are needed to do those surgeries. But essentially, mostly we have the surgeons that can take care of these cancers. However, there is need to invest in training and retraining of medical workers to deal with cancer. We need more oncologists, training of doctors who are specialists in cancer management, radiation oncologists too, people who are specialists in radiotherapy. Now, if we come to radiotherapy as a mode of management of cancer, the truth is we have a way to go in the infrastructure needed for that, because there are few in the country that are functioning. We also need private sector investments in this area of medicine, because obviously the public sector is not catering very well to it. Cancer management is very expensive, and the machines, they need, some of them are so old in the centers where they are, and they are faulty. So you work today, tomorrow is not working, and you keep having these itches. Now, cancer doesn't wait for the patient to get the treatment. Sometimes you see people go to the treatment centers. We don't have one in Makurdi right now, radiotherapy. So our patients from Makurdi have to go to either Abuja or they will go to, I think, Zaria to get these treatments, radiotherapy. So you can see that there's a serious problem, because we do have a lot of cancer patients in Makurdi and in Benue State and in other parts of the country, but they don't have access to the radio. So by the time a patient moves from point A to point B, say from Makurdi to Abuja, then there's a waiting list. And then the pressure on those machines is very high. Some of these facilities, they have to walk around the clock 24/7 on those machines. People are coming, some people are booked in the night and in the day and all of that, to be able to meet up with demand. And yet, people would, when you come for the treatment, they will not tell you wait for 3 months for you to reach your turn. Okay? Now, if you're waiting for 3 months, your cancer may have been in stage 2. By the time it's 3 months, you have moved to stage 3 or even further, because the cancer is not waiting for you. Meaning that the cancer that was smaller at the time you started your quest to get treatment has gone further. And the longer it stays, the harder it is to treat, to cure. Some cancers can be totally curable, especially when they present early. But also the issue about investment and also funding cancer care is also an important thing, because the NHIA currently is not really fully funding fairly middle class man to a pauper, because it is so involving, it is so financially draining. There's a lot of money going in there. So by the time you now have patients who can't afford care, people just get up from something 3 points, depending on where you are going. We now have some private sector coming in to. Okay,
yes.
So it's more center. There's no radiotherapy surgery. Even the diagnosis of some of this cancer, we don't have appropriate tools to diagnose them. So if we have things like building cancer center, let's say in every state capital, for instance, that would greatly help to improve. So that's an area where the health system needs to also channel a lot of resources. Training of health workers to manage cancer, specialist nurses, specialist doctors in this area. We're providing equipment across the spectrum of cancer care, especially radiotherapy, so that our patients will not have to wait so long, and they will release pressure on the healthcare system in the areas where they are also revamping the ones that are existing. Like I mentioned, some of them are already old, and they are not up to date in what is going on around the world today.
All right.
Thank you.
Okay, we are gradually getting to a close, and Dr. Okpeh, this time you also give us your words on what is needed in terms of proper cancer care management with the right investment. That should be your concluding thoughts.
To conclude, cancer care is a teamwork. All hands must be on deck, so that those that have cried out, the government or the stakeholders, we all have to come out to support someone who is a survivor or who is undergoing the menace of cancer. So all is a team thing. Everyone has to give a listening ear, be empathetic to the cries of someone who is currently dealing with the cancer. A lot of them are there, but they keep just listen, should just tell them about what they've heard, so that everybody is aware, and then they can come to a healthcare center. We also advocate that the government should bring in more support we thank God for the one coming up in Benue State, so that we can all join forces in our little way. We can support someone who is dealing with the problem, and then ensure that the little care or the treatment they can afford, it will go a long way to prolong life, because I think that's...
Okay. Dr. Ben-Ameh, your concluding thoughts.
Yeah, I would like to actually thank the Benue State government for the foresight it had in establishing the cancer center. I hear the foundations are ongoing. I'm also aware that some personnel have been sent for training in cancer care. So that is a step in the right direction. And I would like to ask that the government... Another thing or another aspect that actually, for example, breast cancer, the way the cancer reacts in different individuals differs. So we need to, invest more in research amongst our people, indigenous research, so that we find out how better to diagnose and treat the type of cancer that affects us here. We've been, taking up or downloading the way cancer is managed in other parts of the world and adopting it here. That needs to change, because there is now what we call targeted therapy too. And I would ask any stakeholder that is able to invest in cancer research to do so speedily, so that we can give better care to our people. Thank you.
All right, and that will be a fine place for us to leave it on today's edition of the program. Dr. Ugboaja Chisa is a consultant obstetrics and gynecologist at the Federal Medical Center, Makurdi. We thank you very much indeed, Madam, for coming on Perspectives.
Thank you very much. Let's stay safe, screen, and get treated on time.
All right. And Dr. Tongriang Ben-Ameh is a consultant ophthalmologist at the Benue State University Teaching Hospital, Makurdi. We appreciate your time and valuable insights, Doctor.
Thank you for having me. Please spread the message.
All right. Dr. Patience Okpeh is a consultant family physician at the Federal Medical Center, Makurdi. She is also the president, Medical Women Association of Nigeria, M1, Benue State chapter. Thank you, Madam President, for your time.
Thank you, Mr. Nathaniel. We all say prevention is always better than cure. Thank you so much.
Dear listener, that's our program today. This is iGet Radio, corporate social responsibility to bring you this awareness and sensitization on cancer, so you stay safe. Do stay safe. I am Nathaniel Nongu. Join us on Friday for another edition of Perspectives. Have a great week ahead. Goodbye.